Part of the quality improvement program is to reduce the risk of pressure ulcers with our patients. To do this, we use a tool called the Braden Scale.
The Braden Scale is a score or a tool that we do on patients daily, and it's scored out of 23. And the greater the score, the lower the risk for the pressure ulcer.
It has 6 components that are assessed daily. So the first component would be sensory perception, and this is the patient's ability to feel pressure and if there's any pain with the pressure. The next component would be activity, so this is obviously how much activity the patient gets in a day. And the third component is moisture, so how moist the patient's skin gets over the day.
The next component is mobility, so it's whether or not the patient has the ability to independently move themselves in bed or if we have to physically boost them up. Next is nutrition, so how the patient eats, if their appetite is good or poor. And the last component is friction and shearing, so whether or not the patient will slide down in bed once they are in bed, and if there's a risk for their elbows or any other bony prominence of rubbing against their bed sheets. So once we score them out of 23, typically a number greater than 18 means that they pass the Braden Scale. Now if it's lower than 18, that is when we as the healthcare professional would intervene and do some interventions such as
turning a patient every 2 hours. We'd use heel foams, elbow foams, wherever pressure might be. We might use barrier cream or moisturizers. And in special cases, they'll have air beds and air cushions for their wheelchairs. I believe that if the Braden Scale is utilized properly, that it definitely can prevent pressure ulcers.
And as healthcare providers, we're dedicated to providing quality care to our patients, and this is definitely part of providing that care.
Yeah, the Braden Scale is just another tool that will help improve the quality of care given to our patients.